Good day everyone, my name is Chris Daniel M. Sumawang from BSN 1B, and for today I will be conducting an assessment on brachial artery blood pressure. So the goal of this assessment is to assess and measure the patient's blood pressure accurately without any injuries, and the patient only experiences minimal discomfort. So for our equipment, we do need to have a stethoscope, a sphygmomanometer, a blood pressure cuff of appropriate size. Also, we do need to have a pen or a pencil, a paper or a flow sheet, or a computerized record. We also do need to have an alcohol swab or a alcohol wipes. And also, we do need to have an additional PPE as indicated. So now let us proceed to our assessment. So the first thing that we need to do is we need to assess the patient for brachial pulse or the pulse appropriate for the site being used. Next is we do need to assess for an intravenous infusion or breast or axillary surgery on the side of the body corresponding to the arm used. After that is we need to assess the presence of the cast, uh, arteriovenous shunt, or injury, or uh, disease limb. If any of these diseases are, of these conditions are present, we don't need to uh, use the affected arm to assess for the blood pressure. Uh, Next is we need to assess the size of the limb of the patient so that the appropriate blood pressure cuff can be used. Also, we need to know that the right blood pressure cuff should have a bladder length of about 80% of the arm circumference and a width of about 40% of the arm circumference, a length to width ratio of about 2:1. Also, we need to assess the patient for pain. If the patient is reporting about uh, pain, we do need to give the patient a pain medication as ordered before assessing a blood pressure. If the patient is somehow taken a blood pressure while he or she is in pain, we need to make a notation concerning about the pain if the blood pressure is elevated. So now let us proceed to our implementation. So the first thing that we need to do is we need to check the physician's order or the nursing care plan for the frequency of the blood pressure measurement. Also, we need to know that more frequent measurement is maybe appropriate based on the nursing judgment. Second that we need to do is we need to perform hand hygiene and put on our PPEs. So for our third step, we need to introduce ourselves to the patient, and we need to verify the patient's identity. Good day, sir. My name is Chris and I will be your nurse for today. May I know your name? Okay, Sir Ted. So for our fourth step, we need to provide some privacy to the patient by closing the curtains around bed or closing the doors to room is if possible. And also we need to uh, explain the procedure with the patient and assess the patient's ability to assist with the procedure. Also, we need to validate uh, the patient has that the patient has relaxed for several minutes. So, sir, today I will be assessing your uh, blood pressure. Is that okay with you? Okay, sir. Thank you. So for our fifth step, we do need to put on our gloves as appropriate. And now let us proceed to our next step, which is our step 6. We need to select the appropriate arm for the application of the cuff. So we have selected, or we have chosen, Mr. Ted's left arm. And now let us proceed to our seventh step. We need to have the patient assume a comfortable lying or sitting position, um, with the forearm supporting at the level of the heart, and the uh, palm on the hand is facing upward. Also, if the measurement is taken in an supine position, we need to support the arm using a pillow. In a sitting position, support the arm yourself, or use a bedside table. Next is, if the patient is sitting, um, we need to have the patient sit uh, back in a chair so that the chair is supporting his or her body. In addition, we need to uh, remind the patient to keep his or her legs uncrossed during the assessment. So now let us proceed to our eighth step. We need to expose the brachial artery by removing the garments, or move the sleeves if it's not too tight, over the uh, above the area where the cuff will be placed. So as you can see, Mr. Ted is not wearing anything, so there's no problem about removing the garments. We will now proceed to our ninth step. We need to palpate the location of the brachial artery, and we need to center the uh, bladder of the cuff over the brachial artery, uh, about midway of the arm, so that the lower edge of the cuff is about 2.5 or to 5 centimeters above the inner aspect of the elbow. Also, we need to line the artery, marking on the cuff up with the patient's brachial artery. And also we need to um, know that the tubing should extend from the edge of the cuff nearer to the patient's elbow. So for our next step, we need to wrap the cuff around the patient's arm, snugly and smoothly, and we need to fasten it. Also, we do need to remember that uh, we do not allow any clothings to interfere with the proper placement of the cuff. And for our final step in our implementation, we do need to check that the needle of the aneroid aneroid gauge is um, at within the zero mark, and if we are using a mercury uh, manometer, we need to check or check to see the manometer if it is in the vertical position, and that the mercury is at the within the level of zero level, and the gauge is at the eye level. Now we will proceed to the estimation of the systolic pressure of the patient. So the first thing that we need to do is we need to palpate the pulse at the brachial artery or the radial artery by pressing gently with our fingertips. Second thing that we need to do, we need to tighten the screw valve on the air pump. So for our third step, we need to inflate the cuff, and while continuing to palpate the artery, after we inflate the cuff, we need to note the point where the pulse disappears. And for our last step in the estimating the systolic pressure of the patient, we will now deflate the cuff and wait for about 1 minute before moving on to our obtaining the uh, blood pressure measurement of the patient. Now we will be proceeding at the obtaining the blood pressure measurement of the patient. So the first thing that we need to do is we need to um, assume a position no more than 3 feet away from the gauge. And for our second step, we need to place the stethoscope earpiece in our ear, directly put the uh, stethoscope earpiece in our ear canal, and not directly to the ear against the ear itself. So for our third step, um, place we need to place the bell or the diaphragm of the stethoscope firmly, but as little pressure as possible on the brachial artery. We also need to remember to not allow the stethoscope to touch any of the clothings or the cuff itself. So for our next step, uh, we need to pump the pressure of about 30 uh, millimeters mercury above the point at which the systolic pressure was palpated and estimated. After that is we need to open the valve on the manometer and allow the air to escape slowly, allowing the gauge to drop about 2 to 3 millimeters per second. So for our next step, we need to note the point on the gauge, uh, at which the uh, first faint but um, but clear. The sound appears that slowly increase intensity, and we will note that as our systolic pressure. So for our next step, we do need to remember that uh, if we don't need never reinflate the cuff if the air is being released to check the systolic pressure recording. So for our next step, we need to note the um, note the point where the sound completely disappears, and we will note that as our diastolic pressure. And for our last step, since we have done already the deflation of our cuff, uh, we need to allow the excess air or the remaining air to escape quickly, and we will need to, if necessary, we need to uh, repeat suspicious recordings, and before we do that, we need to wait about 1 minute before doing the obtaining the blood pressure measurement. And also we need to deflate the cuff completely between the attempts to check the blood pressure measurements. So, Mr. Ted, I have already measured your blood pressure, and your blood pressure is within the normal range, which is 120 over 80, a perfect and a normal blood pressure count. So for our next step, we need, if the measurement is complete, we need to remove the cuff to the patient and remove our gloves if worn. And we need to cover the patient and help him or her to a position of comfort. Next thing that we need to do is we need to remove our uh, PPE, and we will need to perform a hand hygiene. For our next step, we need to clean our stethoscope, its bell or its diaphragm, using a alcohol swab or an alcohol wipe. After that is we need to clean and store our sphygmomanometer according to its facility and policy. So for our evaluation, the patient was assessed and measured. The patient's blood pressure was assessed and measured accurately without any injuries, and the patient experienced minimal discomfort. And for our documentation, uh, we need to record our findings on the paper or the flow sheet or the uh, computerized record, and also we do need to report abnormal findings to the appropriate person. And the last one is we need to identify the arm or the site of assessment if other than the brachial. So that is all for the assessment of our uh, brachial artery blood pressure. That would be all. Thank you.